What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. In today's video, we are covering the different levels of documentation as an X-ray tech we deal with. So, I've been doing this for about 4 years. I work night shift, 7 on, 7 off, and the documentation process has surprised me significantly because my lady is a nurse. So her level of documentation versus my level of documentation, we do like 1% compared to what the nurses do. It is completely different worlds, right? So, depending on who you work with, you have the typical CP, SOB, shortness of breath, chest pain. You just copy and paste, put it in the little thing. And that's certain techs just do that and they'll be fine. Like literally that's what they ordered said, and that's what you put and you'll be fine. Now, that can fly if it's just a walkie-talkie patient and there's nothing going on, but the problem could lie if maybe they have other stuff going on and you didn't document it properly and you didn't put more than just the basic stuff like that. There's certain techs that are very, very picky with their documentation because at the end of the day, it is your license and the way you want to be treated, because the radiologist will call you and be like, hey, I need more information, depending on what they see. They'd be like, hey, I need more context, or hey, like certain stuff like that. For the most part, the rads sometimes have access to the patient's charts. They can look through it, or if they don't have access, they'll kind of contact us and they'll ask more information. Typically, the order will have the description of why we're doing this, and depending on what's going on, you can just copy and paste that, and then you can go into the patient's chart, and usually depending on what the ER doctor or the nurse, depending who documents first or whatever, you can kind of scan and get a general idea. Or you can have the first hand and go in there and ask the patient, hey, what brought you in, or hey, what's going on, and you can get more information like that. Because sometimes talking to the patient and actually asking why, you could literally end up saving yourself from getting in trouble, which you're supposed to do that with every single time. But I mean, sometimes during morning ports, we really don't do that. It's just like they ordered it, we just do it. I mean, obviously we always look at the reasoning why something got ordered, because certain stuff you need contrast, or certain stuff you need, to document or to shoot stuff differently compared to a traditional image. So there's that aspect of it. I would say it is always important to document if the patient was pregnant and it was shield. Always put it, because you never know if you're gonna get dragged someday in court and they'll whoop it out and all you have is your little notes. Because hypothetically speaking, they'll want you to remember you probably won't. Like if they whoop out a case from the beginning of my career, and I've been doing it for 20 years, and they're like, Miguel, so-and-so date, you have this. This is the picture. Here's your X-ray little stamp. And I'm like, yep, that's mine. That seems to be when I worked at so-and-so hospital, and all I have to base off of why I did what I did was my little notes I put in. So it is always important to document properly, especially if the images weren't optimal, or if the patient was pregnant, or certain stuff like that, to keep you safe, to protect you from any problems. Now, I would say that certain techs document stuff differently, as far as like maybe the order they document, or maybe the way they were trained. Because I've been working in my establishment for about 4 years, and I've seen so many different versions of how the documentation process goes. Like, I've seen both sides of it. And at the end of the day, as long as you get all the check marks and you do everything properly, you should be okay. I always thought we had to deal with like crazy amount of documentation based off of my lady who's a nurse, and I quickly realized we don't have that many unless something happens. Then, because like that part kind of scared me a little bit, because I'm like, dang, I really have to do all this. Because like I've from time to time, when we're slowed down or maybe we're chilling for waiting for to shoot an exam, I'll see just nurses charting and doing what they do, and I'm like, they have so much stuff they have to deal with, and I'm like, couldn't be me. Just like, I would probably forget something. Like, ours is like so simple. It's like, begin the exam, documentation, the reason, who helped you with the exam, what did the patient say, did you have to change the order, did you give gastrographin or contrast, was there consent signed, what did the patient do. That, like, there's certain basic stuff that, like, certain stuff to end the exam, you have to document it before you can completely end it, or else the system won't let you end it. So, or billing or whatever stuff going on. So that kind of covers the basis of documentation in the X-ray world, at least in the emergency room where I work at. Obviously, if you do mobile radiology in other places, you have to document different stuff, and certain places are more picky depending on the radiologist you have to work with. So yeah, I mean, I'm here to educate you in all aspects of this beautiful field of radiology, and yeah, we'll see you on the next one.